two, one, two, three.
Hello and welcome to Ithaca DSA Presents. I'm Theresa Alt. I'm here today with Susan Beckley, a small business manager here in Tompkins County, and also a longtime healthcare activist. Susan, you are just back from Albany. Now, we know that things that get decided in Albany have huge effects on us here. So what was this trip about?
We left on Tuesday. A couple of friends, myself, drove up to a rally that the advocates for the New York Health Act were holding outside of the legislative buildings in order to let the legislators know, the assembly and the state senators, that now that the budget has been passed, that we really want them to look at the New York Health Act and see about getting it out of committee to a floor vote in both the assembly and the state senate, so that we know how the votes would go and who the proponents are and where people stand on this issue. Our understanding is that we have a majority of endorsers in the assembly, and we have a majority of endorsers in the state senate, but it's not being brought out for a vote on the agenda by the leadership of the Democratic Party. And so our action was to visit the assembly and state senator offices in small groups to advocate and for them to put pressure on leadership and their colleagues to bring this bill out for a vote, so that we can see about getting universal single-payer health care for all New Yorkers.
It sounds as if you had two different kinds of activities in Albany, one being a rally.
Yes.
You are nodding. And the other being visits to assembly and senate offices.
That's correct.
Well, actually, let's start with one piece of nitty-gritty. It's the New York Health Act is a bill.
That's correct.
Well, bills have numbers. Let's get those numbers straight.
Well, be sure that when you're identifying these numbers, S5474, that's the state Senate bill, that it's for the legislative session 2021-2022. If you just put in, when you're looking up the bill, S5474, it also refers to different legislation in other sessions previously. I looked up S5474 for the Senate in the 2019 legislative session, and it referred to capital gains bill. So be sure you're looking at the 21-22 session with these bill numbers. It's S5474 for the Senate, and it's A6058. That's 6058. You need the A before it. And for the Senate bill, you need the S for it when you plug it into the state Senate site or the state assembly site. But be sure you're in the right legislative session.
And getting back to what you were actually doing in Albany.
Yes.
You went to a rally. Who spoke at the rally?
Well, we gathered outside of the legislative buildings around 10:30. The rally began with people with signs and advocacy for the New York Health Act, and a number of legislators came by. The key members were, Assemblyman Richard Gottfried, who is the author of the bill and chair of the Health Committee in the Assembly, and he spoke. Anna Kellis from our 125th Assembly District here in Tompkins and Cortland County spoke for a few minutes. She's a wholehearted endorser of the New York Health Act. There were a couple of other people a number of people that were from downstate, but there were a few from, there's a woman by the name of Pamela Hunter, who's a assembly person from Syracuse. Al Sturpey, maybe some people have seen him. He's in Syracuse as well.
Well, it doesn't really matter. We don't need an exhaustive list.
Exactly. Senator May, who is actually a very strong proponent, she's from Syracuse, and she's the chair of the Aging Committee. And she's a wholehearted supporter of this bill, certainly for the aging community as well.
Good to know. And maybe you can also tell us when you went to visit offices, whom you spoke with.
Right. So we broke up into different groups. The Campaign for New York Health, the campaign had put the rally together and differentiated the upstate groups from the downstate groups so that we all met with legislators from our areas. And so I was a leader on a list where we went to 5 different offices, Al Sturpey's, Pamela Hunter, both in Syracuse, Magnarelli in Syracuse, Donna Lupardo from Binghamton, and Marianne Butenschon from Utica. I don't know about Butenschon. I don't see her listed as an endorser, but the other individuals are all endorsers on the bill. And part of we were giving them additional materials that was left at their offices to encourage them and give them talking points to speak to leadership and their colleagues about getting this bill out for a vote. And that was our main purpose, is to promote the bill and get those people who are pretty much on board already. They're endorsers. That's a majority of the both houses, to bring this legislation onto the agenda for a floor vote.
Yeah, it's these days, it seems to be motherhood and apple pie for a legislator to say they're for the New York Health Act, to sign on as a sponsor, and yet some of them have in recent past years been very hesitant to vote.
Yes. And we just wanted to let them know that we haven't forgotten their campaign promises. It was very interesting. There were a couple of downstate people where their legislators had won their district seat and did not sign on to the New York Health Act. And these constituents were just ripping them apart, asking them what is going on. And so it was really good to have them be held accountable and make them feel a bit uncomfortable that we're paying attention to the campaign promises. And this is just not political for political sake and just to get elected. We want this legislation to move. Yeah. It's finished legislation. It's very easy to read. I recommend everyone to go on to the legislative sites and take a look. It's only 29 pages long, and most of it has to do with how it's structured with their board of directors and regional councils, that type of thing. But essentially, it's saying that this is going to provide universal single-payer health care for all residents of New York, regardless of age and wealth and status, and that there will be no copays, there'll be no deductibles, and there's no private premiums. It will be based upon income.
Now, I know our county legislator, Mike Sigler, has been claiming that it could be very expensive. And personally, I don't believe that, but maybe you could address that.
Yeah, I haven't been able to sit down and speak with him, but the bill would be expensive if it did not have any savings, which this bill has tremendous savings with it, as well as if you were also paying for private health insurance. This bill, by being a universal single payer healthcare system, will eliminate private insurance that would duplicate what the New York Health Act covers. And so all of those premiums that people are paying, all those premiums their employers are contributing to, those go away and they are replaced by a taxing mechanism based upon income. So just like when you're paying for, when you get your pay stub and you have Medicare and Social Security taken out, you would have a line for New York Health being taken out also and contribute to the New York Trust Fund that pays all the bills. So all of your providers, all of the hospitals, the doctors, the clinics will be sending their bills to the trust fund, and it eliminates all this private insurance that is a tremendous amount of overhead for providers. The bill covers dental and vision and hearing as well as medical devices that are all of which that are medically necessary. It's not going to cover things like cosmetic surgery or something that is more subject to taste or choice, that type of thing. But anything that's medically necessary is to be covered. And that leads to a lot of preventative care. I mean, people don't want, I had a comment that consumers want to be healthy. They don't want to pay for medical treatments. And so if you can preemptively catch cancers early, catch diabetes early, a whole slew of other things that can get worse over time, you'll have just savings in a longitudinal way, but also productivity. People will be less sick. Employers will benefit because they will have a dependable workforce. And their employees don't have to worry about healthcare costs, and employees don't have to worry about having their health tied to their employment. They can become self-employed, they can change jobs, and their health care will continue to be covered regardless.
I can certainly relate to that. Long ago, when I reached the age of 40, I gave up what the career I was trying to have in order to take a secretarial job that offered health insurance, because I just said it's not safe to live without it any longer.
That's true. It's true. And we have a large population in this state who don't have health care or have they're underinsured. They have like $5,000 deductibles. Well, they don't go to the doctor because they would have to pay the first $5,000 out of pocket. So they're paying premiums and they're still not going to the doctor. And the insurance companies are just making money off of that. People don't want to go to the doctor if it's not necessary, but they should go to the doctor if they need to. And that's what this bill will provide for our residents.
Well, as you say, if they need to, but also if they think they may need to.
Well, I mean, that's one of the nice things about this bill is that there's care coordination. So it's not like, Theresa has a headache, so she wants to go to a neurosurgeon. It's sort of like, well, you get in touch with your primary care physician, and they will determine what the course of action is for you. And so the specialist will be used a lot more judiciously because we will have the medical personnel knowing your entire health concerns and needs, which makes it a much more effective way to treat patients and give care.
Maybe we could zoom in a little closer on the financing mechanism.
Mm-hmm. The bill stipulates that it's to be paid for with a progressive, graduated tax system on payroll income. But the unique thing about this bill, it also includes non-payroll income. So those people who are getting income from capital gains, from dividends, from interest, that income is taken into account for contributions to the New York Health Act. So that being said, the rates will have to be determined when the bill passes because they have to take the look at the whole pool of people. But the bill does stipulate that it's at least, if you're employed, an 80% from the employer to a 20% for the employee to contribute. The employer can contribute more, certainly with unions and all. They can negotiate that the funding mechanism would be that the employer could pay all of it for the employee, or partially up. Well, they have to pay it up to they have to pay 80% or more. And the first, and it's stipulated in the bill that the first $25,000 of everyone's income is exempt. So, for example, if you earn $35,000 a year, the first $25,000 would be exempt. You would be paying only on that $10,000 difference in income. If you make $75,000 a year, that $25,000 is exempt. You would be paying on the $50,000. It's yet to be determined what those percentage brackets will be and where they will kick in.
Okay. and excuse me, what you have described so far is in the bill?
Correct. The 25,000, it's 50,000 for people 65 and above. The first 50,000 would be exempt. So if you were a retired person who was 65 and made $45,000 in retirement, taxable retirement income, you would be exempt. So you would not have to do additional contribution. Also, the nice thing with Medicare age people, Medicare people have deductibles and copays. The New York Health Act will pick those up. So as a Medicare recipient, you would not be paying copays or deductibles. And that $125 to $135 a month that's taken out of your Social Security as a premium payment to Medicare, the New York Trust Fund will pay also, because since the other citizens of the residents of New York State are not paying any premium costs, it's all based on income, then New York Health would have to pick up that cost that is paid to the federal government.
So I think the point is that while it would cost employers and residents this, that, and the other, it would mean that there are all sorts of things that they're paying for now that they won't be paying for.
Well, let me give you an example. For instance, Tompkins County, what's stipulated and identified in the bill is that the Medicaid mandate goes away. So the counties have to pay for their Medicaid costs as it stands now. And so Tompkins County, with that Medicaid mandate going away, would save over $11 million a year for the county budget. So you could reduce property taxes. It's all based on property taxes. The Tompkins County employees, the health care expenses for Tompkins County employees would save over 4.5% of the entire budget. Again, that affects property taxes. Ithaca City School District, we're paying for the healthcare coverage of the staff of the school district. That being said, in savings, you would have better coverage. Ithaca City School District, and these are according to studies that have been done on the New York Health Act in implementing them, would save over $18 million a year for the school district. Now, your school taxes and your county budget taxes are all based upon property values. So people could very well be paying a lot less. It certainly depends on the county legislature passing a reduction in property taxes and school boards voting for less, property taxes. But the city school district would have over 13% of the entire budget saved if they gave that, back to county property owners. And even if it wasn't all given back, I'm sure that school districts have a lot of other things that they could do with some of those funds rather than sending them to private insurers.
Yes, and we will have to make sure that when landlords see their property taxes cut, they pass on the savings to the renters, because one thing that is often hidden these days is how much in property taxes renters pay just through their rent. It gets, they don't necessarily know how much, and some people think it isn't there, but it is. So perhaps you could describe what happens when the bill passes. Let's say it passes in late June this year. What then?
Okay, so the last line of the bill says that it's to be implemented, quote, immediately. What that means is that the New York Health Act creates a new article in the public health law, Article 51. That is the entire bill. In that bill, it stipulates that there is a temporary commission created, be 15 members that are legislative members that are picked by leadership, governor and majority and minority leaders, to begin the implementation of Article 51. And so then that implementation is written up and needs to abide by current law, and that there's not conflicts and that type legal conflicts in what's established. And then it goes to the government of how to implement the bill. That's a temporary commission. In the bill, there's a board of trustees that's created. It's like 28 individuals who are, and it's identified in the bill as to what who they represent. There are physicians, there are non-physicians, there are unions, there are hospitals, there are clinics, there's hospices. They're all identified as representatives for on the board of trustees. There's 6 regional councils with like 27 members, again, stipulated in these different medical expertises. And those 6 regional councils, because New York State is very diverse, that those 6 councils make their recommendation in an ongoing fashion. They're permanent to the board of trustees for any changes, implementations in an ongoing fashion for conducting the New York Health Trust Fund.
So when could we see benefits from this?
We would hope in a year. but that might be optimistic. There are some things that also need to get worked out. For instance, workers' comp needs to be addressed. And if you have small business owners, I mean, a variety of the businesses that I have managed, workers' compensation costs are immense. I'm talking many thousands of dollars. And if those can be reduced because the medical care for workers who are injured on the job would be taken care of, in a lot of ways, that would more than offset a lot of the costs, certainly for small business owners, like, under 50 employees, whatever, to be able to pay for those medical premiums, as it were, medical payroll taxes for the New York Health Act that are incurred by their employees, of that 80% that the employer needs to be responsible for.
And I can see I won't have to be buying Medigap insurance anymore.
There won't be Medigap. You won't have Medicare Advantage. You won't have direct contracting entities that can make 40% profits. Their main owners are equity firms. Wall Street equity firms are putting together these Medicare Advantage type plans because it's very, very profitable. And we're trying to get that profit motive out of healthcare, because I don't feel that
because New York Health would offer pretty much everything that Medicare so-called Advantage boasts about, except maybe health club memberships or something.
And exactly. And it's going to cover vision, dental, and hearing, as well as medical devices. So hearing aids, glasses, dentures, walkers, wheelchairs, those types of things that are very difficult for people to afford.
Well, great. I have been talking with Susan Beckley. This is Ithaca DSA Presents. I'm Theresa Alt. Thanks for watching.